This is All India Radio. We now bring you a special news program on COVID-19. Good morning, I'm Valsa Williams and with me is Subhadra Ramachandran. The headlines. Government to begin evacuation exercise Vande Bharat mission from today to bring back nearly 15,000 stranded Indian citizens from 12 countries. Home Ministry issues guidelines for movement of stranded Indian nationals returning to the country. Government bans export of alcohol-based hand sanitizers in view of COVID-19 outbreak. Centre asks West Bengal government to lay emphasis on surveillance, detection and testing. Mortality rate stands at 13.2% in the state. And Prime Minister Narendra Modi to deliver keynote address at Buddha Purnima celebrations today. In one of the largest evacuation exercises named the Vande Bharat mission, the government will operate 64 flights from today till May the 13th to bring home nearly 14,800 Indian nationals stranded abroad due to the coronavirus lockdown. Minister of External Affairs S. Jaishankar said on Tuesday that preparations for the operation have commenced and also urged the stranded individuals to stay in touch with the Indian embassies in their countries. The 64 flights will include 10 flights from the UAE, 2 from Qatar, 5 from Saudi Arabia, 7 from UK, 5 from Singapore, 7 from the United States, 5 from the Philippines, 7 from Bangladesh, 2 from Bahrain, 7 from Malaysia, 5 from Kuwait, and 2 flights from Oman. Out of the total, 15 flights will bring back people to Kerala, followed by 11 flights each to Tamil Nadu and Delhi. 7 flights will be flying back people to Maharashtra and Telangana, whereas 5 flights are slated for Gujarat. The maximum number of flights in the first week of repatriation will bring back citizens from the Gulf countries. Details from our correspondent.
These special flights will be operated by Air India and its subsidiary Air India Express. The stranded people will have to bear the cost of travel. Government has clarified that only asymptomatic passengers would be allowed to travel. Besides, strict adherence to the standard operating protocol for the complete process has to be followed by the carriers. State governments have been advised to make arrangements including for testing, quarantine and onward movement of the citizens upon their return. With Anand Kumar, Suparna Sekia, AIR News, Delhi.
Our Dubai correspondent reports that more than 350 Indians from the UAE will be flying back home today as India starts one of the world's biggest repatriation processes.
The provision for special flights to fly back home has come as a big relief to the Indian community here. The first flight from UAE today will see approximately 350 Indians flying back to Kochi and Kozhikode. Workers who are in extreme distress situation, senior citizens, some pregnant women, students, infants, and at least 3 Indian citizens who were stranded at the airport during the transit are some of those who will be flying back today. Health screening of shortlisted passengers will be done by the UAE health authorities at the departure terminal of the Abu Dhabi and Dubai airport. Only those who are found asymptomatic will be allowed to proceed. All passengers will be required to sign an undertaking to undergo compulsory quarantine at the destination of arrival and bear the cost of the same. Kanchan Prasad, AIR News, Dubai.
Meanwhile, the Navy has also sent 3 of its ships under Operation Samudra Setu to get back stranded citizens from the Maldives and the UAE. INS Jalashwa and INS Magar will bring back Indians from the Maldives, while INS Shardul has been diverted to Dubai to bring back the expatriates. Talking exclusively to All India Radio News, India's High Commissioner to the Maldives, Sanjay Sudhir, said elaborate arrangements have been made for the evacuation of Indian citizens.
In the wake of COVID-19 pandemic, Government of India has launched its biggest ever global evacuation operation. For Maldives also, the evacuation we will witness in the next few days and weeks will be the largest ever in our history. I am grateful to Indian Navy to launch Operation Samudra Setu to evacuate close to 2,000 Indians from Maldives to India by creating a virtual sea bridge.
The evacuated personnel will disembark at Kochi in Kerala and be entrusted to the care of state authorities. More from our Colombo correspondent.
The first evacuation of Indian nationals from Maldives will happen on Friday, and a Navy ship is scheduled to bring around 700 Indians back to Kochi. Another ship will depart for Tuticorin, carrying more than 1,000 persons. Maldives has more than 25,000 Indian nationals employed in tourism and other sectors, but COVID crisis has affected livelihood of most of them. More than 50 Indians have also been tested positive in Malé, which is worst affected and is most vulnerable to the crisis. Indian High Commission in Malé is giving preference to medical emergencies, pregnancy cases, stranded tourists, and job losses of migrant workers for repatriation. There are hundreds more who are looking forward to be with their near and dear ones in this crisis, and they look forward to evacuation plan in coming weeks. Santosh Kumar for AIR News from Colombo.
The Telangana state government is making all arrangements to receive and quarantine 2,350 stranded Indians who are coming home from various foreign countries.
Air India flights will start repatriating stranded and distressed passengers from various countries to Hyderabad for a week from today onwards. It is estimated that 2,350 passengers are expected to land in Hyderabad. The first flight will be carrying 200 passengers on board from San Francisco to Hyderabad via Mumbai. These passengers will arrive at Shamshabad International Airport in 7 flights from 6 countries, including the USA, Britain and UAE, during next 1 week. State Chief Secretary Somesh Kumar held a high-level review meeting and asked senior officials to make arrangements for them for institutional quarantine for 14 days. Lakshmi, AIR News, Hyderabad.
The Union Home Ministry has issued standard operating procedures SOPs for movement of Indian nationals stranded outside the country and also for persons stranded in India who are desirous to travel abroad for urgent reasons. As per the SOPs, priority will be given for travel from abroad to compelling cases in distress, including migrant workers who have been laid off, people facing expiry of short-term visas, those with medical emergency, pregnant women and the elderly will also be given priority. Before boarding, all travellers will have to give an undertaking that they will undergo mandatory institutional quarantine for a minimum period of 14 days on arrival in India. At the time of boarding, all travellers will undergo thermal screening and only asymptomatic travellers will be allowed to board. The passengers will have to register on the Arogya Setu app.
A total of 49,391 confirmed cases of novel coronavirus or COVID-19 have been reported in the country so far. Out of them, 14,182 patients have recovered after treatment and were discharged from the hospital, while 1,694 patients have died. Health Ministry said the recovery rate of corona patients has reached to 28.72%. The ministry said government is taking several steps along with the states and union territories for prevention, containment and management of COVID-19. Health Minister Dr. Harshvardhan has reviewed preparedness and containment measures taken for COVID-19 management in Gujarat and Maharashtra through video conferencing. Dr. Harshvardhan assured all support to the states. After a brief presentation on the status of COVID-19 cases in the states, Dr. Harshvardhan expressed concern regarding the high fatality rate due to COVID-19 in some districts of the states. He said states need to focus on more effective surveillance, contact tracing and early diagnosis to reduce high fatality rate. He also said proper interventions, screening and testing of severe acute respiratory infections and influenza-like illness cases need adequate attention. He stressed that implementation of effective containment strategy needs to be on the top priority of the states to reduce the mortality rate. The central government has started Arogya Setu Interactive Voice Response System IVRS services to cater to people having feature phone or landline. This service is available across the country. It is a toll-free service where citizens are asked to give a missed call to the number 1921 and they will get a call back requesting for inputs regarding their health. The questions asked are aligned with Arogya Setu app. Based on the responses given, citizens will also get an SMS indicating their health status and also will get further alerts for their health moving forward. The service is being implemented in 11 regional languages, similar to the mobile application.
The railways have carried more than 54,000 tons of consignments through parcel trains during the lockdown period and earned more than 19 crore rupees. Railways has made parcel vans available for quick transportation of essential items in small parcel sizes to supplement the supply chain during the lockdown. More from our correspondent.
The parcel trains are providing big boost to transportation of essential commodities and other goods across the country during the lockdown. More than 2,000 parcel trains were operated so far. Railways is also running timetabled parcel special trains on select routes to ensure uninterrupted supply of essential items. Railway zones are regularly identifying and notifying routes for these trains, and presently they are being operated on 82 routes. Parcel trains are supplying agricultural inputs, medicines, medical equipment from producing regions to other parts of the country. The parcel service is also supplying milk and dairy products from surplus regions like Gujarat and Andhra Pradesh to high demand regions, besides moving other essential items. With Dipendra Kumar, Suparna Saikya, AIR News, Delhi.
Under the Lifeline Udan scheme, 465 flights have been operated to deliver critical medical supplies across the country so far. 835 tons of cargo have been transported by these flights, covering over 4,51,000 kilometers. The Civil Aviation Ministry is operating Lifeline Udan flights to transport essential medical cargo across the country, including remote and hilly areas to support India's war against COVID-19. Helicopter services, including Pawan Hans Limited, have been operating in areas including Jammu and Kashmir, Ladakh and the northeastern region, transporting critical medical cargo and patients. In the Bastar district of Chhattisgarh, women's self-help groups are making materials necessary to prevent the spread of coronavirus infection. At the initiative of the Zilla Panchayat, the members of these groups are also strengthening their economic condition during the lockdown. A report from our Raipur correspondent.
Bastar district of Chhattisgarh, which is usually in the news because of Maoist violence, is setting an example of women empowerment at the time of pandemic. The district panchayat administration has encouraged the self-help groups of this area to make face masks necessary for the prevention of corona infection. Under the National Rural Livelihood Mission, more than 100 women of 41 self-help groups are engaged in this work. These women have made around 50,000 masks so far. These masks have been distributed to health workers and policemen as well as various government departments and Manrega labourers. These self-help groups have earned more than 3 lakh rupees. Vikalp Shukla, AIR News, Raipur.
In Uttar Pradesh, the Indian Institute of Technology Kanpur has joined hands with Bharat Dynamics Limited for the development of affordable ventilators for COVID-19 treatment. Our correspondent has the details.
In response to the clarion call of the Prime Minister Narendra Modi, a startup of IIT Kanpur designed and developed an high-end and affordable indigenous ventilator necessary for providing life support to critically ill COVID-19 patients under the overall supervision of IIT Kanpur team led by Professor Amitabh Bandyopadhyay. Abhay Karandikar, Director IIT Kanpur, told AIR,
हमें बड़ी खुशी है कि हमने यह वेंटिलेटर मेक इन इंडिया के तहत पूरा यहाँ पर ही विकसित किया है और हम एक 1.5 महीने के छोटे अंतराल में एक वर्ल्ड क्लास प्रोडक्ट को बनाने में सफल रहे हैं। आशा है कि भारत डायनामिक्स लिमिटेड इसका निर्माण अभी शीघ्र ही करने लगेगा और मई के अंत तक हम बड़ी मात्रा में वेंटिलेटर सप्लाई करने में सक्षम रहेंगे।
Apart from providing support to the critical patients, the ventilator's design also has unique features to safeguard the frontline healthcare workers from exposure to the virus. Sushil Chandra Tiwari, AIR News, Lucknow.
This is All India Radio bringing you a special news program on COVID-19. Let's take a look at the headlines once again. Government to begin evacuation exercise. Vande Bharat mission from today to bring back nearly 15,000 stranded Indian citizens from 12 countries. Home Ministry issues guidelines on movement of stranded Indian nationals returning to the country. Government bans export of alcohol-based hand sanitizers in view of COVID-19 outbreak. Centre asks West Bengal government to lay emphasis on surveillance, detection and testing. Mortality rate stands at 13.2% in the state. And Prime Minister Narendra Modi to deliver keynote address at Buddha Purnima celebrations today. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The Union government has banned the export of alcohol-based hand sanitizers. A notification issued by the Directorate General Foreign Trade (DGFT) said the centre has amended the notification of 24th March related to the export policy of sanitizers with immediate effect. Union Home Secretary Ajay Bhalla has written a letter to the Chief Secretary of West Bengal after receiving feedback from two interministerial central teams, IMCTs, which visited the state. Mr. Bhalla in the letter said COVID-19 in West Bengal is characterized by very low rate of testing and very high rate of mortality at 13.2%. He said mortality rate due to COVID-19 in West Bengal is by far the highest for any state. The Home Secretary said it is a reflection of poor surveillance, detection and testing in the state. He said there is also a need to increase random testing in crowded clusters. Mr. Bhalla said lockdown violations have been noted in Kolkata and Howrah by specific groups in specific localities, with media reports of corona warriors, including police, being attacked. He said it necessitates stricter enforcement of lockdown by enhancing police presence. The letter said there have been instances of overcrowding in bazaars, bathing of people in rivers, people playing cricket, football during lockdown in West Bengal. He said there is serious laxity in enforcing lockdown measures in containment zones. The Home Secretary expressed concern at poor community awareness, especially among labourers. He also said there should be strict action against violators. Mr. Bhalla said testing facilities need to be set up in hill districts. He said the state should also ensure that quality of PPEs and N95 masks conforms to ICMR standards and protective equipment is available for doctors and medical staff in non-COVID hospitals as well, as they are equally exposed to risk. Prime Minister Narendra Modi will participate in the Buddha Purnima celebrations today. The Ministry of Culture, in collaboration with the International Buddhist Confederation, a global Buddhist umbrella organization, is holding a virtual prayer event with the participation of all the supreme heads of the Buddhist Sanghas from around the world. Mr. Modi will deliver a keynote address in the morning. Buddha Purnima celebrations are being held through a virtual Vesak Day owing to the impact of the COVID-19 pandemic across the globe. The event is being organized in honor of the victims and the frontline warriors of COVID-19. Vesak Buddha Purnima is considered the triple blessed day as Tathagata Gautam Buddha's birth, enlightenment and Mahaparinirvana.
Prime Minister Narendra Modi had a phone call yesterday with Prime Minister of Ethiopia, Dr. Abiy Ahmed Ali. Mr. Modi recalled the close ties between India and Ethiopia and the excellent development partnership between the two nations. The two leaders discussed the domestic, regional and global challenges posed by the COVID-19 pandemic and expressed solidarity with each other during the health crisis. Work sites in the Union Territory of Jammu and Kashmir have opened. AIR correspondent report the J&K government has invited labourers for work at various work sites where they will be provided all basic amenities like kerosene, PWS clothing, tents, shelter, vehicle for arrival, ration, etc. Government has identified several schemes and work sites where they can work and earn their livelihood. Meanwhile, Higher Education Department in J&K has ordered that class work of all educational institutions will remain closed till May 30, 2020. In Rajasthan, more than 52% of the total COVID-19 infected patients have been recovered so far in the state. Yesterday, 214 people have been tested positive to negative. More from our correspondent.
Corona cases have been reported from 30 out of 33 districts of the state, but there is no longer a single active patient in Churu, Hanumangarh, Jhunjhunu, Karoli and Savaimadur district now. At the same time, the number of active patients in 10 districts is just less than 5. Jaipur and Jodhpur are the most affected cities. Meanwhile, doctors of SOS Medical College in Jaipur have used plasma therapy for the treatment of 2 COVID patients, which has been successful. Jitendra Dwivedi, AIR News, Jaipur.
In Gujarat, 380 new COVID-19 positive cases and 28 deaths were reported yesterday, taking the total case count to 6,625. The total deaths due to COVID-19 rose to 396. State Health Department said Ahmedabad reported the highest 291 cases and 25 deaths yesterday. Our correspondent reports that all the shops in Ahmedabad except the shops selling milk and medicines will remain closed till 15th May in the wake of rising number of cases in the city. A report.
Principal Secretary of Department of Health Jayanti Ravi said 119 people were discharged after recovery yesterday, taking the overall number of discharged in the state to 1,500. The number of active cases in the state now stands at 4,729, out of which 26 patients are on ventilator. To control the spread of coronavirus in Ahmedabad, civic authorities yesterday ordered closure of all the shops except those selling milk and medicines for a week. This also includes shops selling fruits and vegetables. 8 companies of paramilitary forces have been deployed in the city to further strengthen the lockdown. Meanwhile, more than 1,500 people from Gujarat who are stranded abroad will be brought back to the state in this week. First such flight carrying 250 Gujaratis stranded in Philippines will arrive in Ahmedabad today. Aparna Khund, Air News, Ahmedabad.
Tamil Nadu has recorded 771 new COVID-19 cases yesterday. They include 324 in Chennai and 188 in Ariyalur districts. Many of them are the contacts of the workers in the wholesale market in Chennai that has become a major flashpoint for the infections in the state. 31 people were discharged and 2 people lost their lives due to the disease yesterday. So far, 35 people have lost their battle against the pandemic. More from our correspondent.
In a positive development, the wheels of knitwear factories in the country's hosiery capital Tirupur have begun running since yesterday. The district administration has asked the management to ensure that the state government guidelines based on the centre's directives are followed in letter and spirit. Workers are allowed after thermal screening and the factories are being run with limited staff every shift. Similarly, in almost all the industrial estates that fall outside the containment zones, factories have restarted their work since yesterday. However, the usual work style has undergone a sea change due to the lurking pathogen. Jai Singh, AAR News, Chennai.
In Karnataka, the free bus service for migrant labourers will conclude today. Deputy Chief Minister Lakshman Savadi has informed that around 1 lakh migrant labourers were transported to their hometowns within the state in 3,500 KSRTC buses since Sunday. More from our correspondent.
The Minister Lakshman Savadi has asked the Transport Corporation employees not to worry about their salaries as Chief Minister has assured a sum of 326 crore rupees for this purpose. He said half of this assured amount has been sanctioned and salaries will be credited to the employees' accounts in 3 or 4 days. Meanwhile, the Health and Family Welfare Department has issued a circular to all the hospitals treating COVID-19 positive patients in the state to use RT-PCR mobile app while dispatching samples to the testing labs. It has warned of disciplinary action against the lab in charge if specimen referral form sent manually is accepted by them. This measure is taken for proper monitoring of samples tested and results declared. Sudhindra, AIR News, Bengaluru.
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and mythbusters. The Central Board of Indirect Taxes and Customs has refuted claims that the government is offering any refunds. In a tweet, CBIC appeals to taxpayers to not click on any fake link which promises to give refunds. It said these are phishing messages and are not sent by CBIC or the GST network.
Indian celebrities and actors have urged the people to guard against fake news. Indian cricket captain Virat Kohli, actors Ayushmann Khurrana and Sara Ali Khan made an appeal against forwarding unverified messages referring to the hashtag #MatKarForward.
यार मेरे कजन की वजह से ना पूरे घर में ठंड एक ही करके ना सब लोग इसके चपेट में आ जाए एक लापरवाह टच से लाखों तक पहुंच जाता है और एक बार ये महामारी फैल गई ना बॉस इसे कोई नहीं रोक सकता जी हाँ हम बात कर रहे हैं उन फॉरवर्ड्स और वीडियोस की जो नफरत और अफवाहें फैलाते हैं ये भी हमारे समाज का एक वायरस है उत्तर दिशा में सोने से डायबिटीज ठीक हो जाता है देखिए कैसे देश को बर्बाद कर रहे हैं ये वीडियो 10 लोगों को फॉरवर्ड कीजिए गारंटी रहेगा ऐसा करने से ना कैंसर ठीक हो जाता है वैसा करने से ना भूकंप आ जाता है ऐसे वीडियोस और मैसेजेस फॉरवर्ड नहीं होने चाहिए और बनने भी नहीं चाहिए जब भी आपको कोई ऐसा वीडियो मिले वो ऐसा मैसेज दिखे जो आपको सही ना रहे अगर उससे किसी का नुकसान हो सकता है अगर सूचना सीधा गवर्नमेंट से नहीं है तो उससे मत कर फॉरवर्ड और देखोगे कि ऐसा करने से तुम सेफ रहोगे लोग सेफ रहेंगे और देश सेफ रहेगा तो मत कर फॉरवर्ड।
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Director AIMS, Dr. Randeep Guleria advised people, and especially to those in the hotspot zones, to sincerely follow lockdown measures to break the chain of transmission of COVID-19 infection.
I would advise everyone, especially those who are in the hotspots, to really sincerely, as citizens in a patriotic manner, observe this lockdown, because if we observe this lockdown in a fair manner, we will be able to break the chain of spread and we will be able to bring down cases and be able to prevent deaths and conquer corona in India.
Dr. B.N. Gangadhar of National Institute of Mental Health and Neurosciences, Bengaluru, advised people to do exercises and practice yoga to make themselves free from anxiety and stress.
You can do the exercises together with your family members. You can do the yogasanas or meditation together with the family members if you have learned, or if somebody can teach you, a neighbor can demonstrate. Other videos are available today. You can actually do bhajans together. You can watch some healthy TV programs together.
Amarjeet Kumar Singh of Samastipur, Bihar has received benefits under the PM Kisan Samman Yojana. He said the scheme has provided much needed support during the COVID-19 outbreak.
मेरा नाम अमरजीत कुमार सिंह, समस्तीपुर जिला के कल्याणपुर प्रखंड वासुदेवपुर पंचायत वार्ड नंबर 2, जिसमें किसान सम्मान निधि योजना के तहत लॉकडाउन में 2000 रुपया मिला। इसके लिए मोदी सरकार जी को धन्यवाद।
Principal Scientific Advisor to the Government of India, Dr. K. Vijay Raghavan, has said the initial genome sequencing reports suggest that the coronavirus strain in the country has not mutated to be more virulent than elsewhere in the world. In an exclusive interview to AIR News, he said India is both indigenously and with support of other partner countries working on development of a vaccine for COVID-19.
That Indian companies which are known for manufacturing vaccines but not necessarily at the forefront at early stage are partnering both internationally and separately nationally to make vaccines. So there is both an Indian effort as well as a partnership effort. Similarly, Indian academia has got into vaccine design and vaccine development at early stages, looking at plant-based products and traditional medicine to see if they have antiviral properties has been going on for some time. That research is accelerating.
U.S. President Donald Trump has described the COVID-19 pandemic as the worst attack ever on the United States. Mr. Trump said the pandemic had hit the U.S. harder than the Japanese bombing of Pearl Harbor in World War II or the 9/11 attacks 2 decades ago. His administration is weighing punitive actions against China over its early handling of the virus outbreak. Since emerging in China at the end of last year, the coronavirus is confirmed to have infected close to 1.2 million Americans with 73,000 casualties so far. As Europe and the US loosen their lockdowns against the COVID-19, health experts are expressing dread over an all-but certain second wave of deaths and infections that could force governments to clamp back down. Dr. Ian Lipkin of Columbia University's Center for Infection and Immunity says the world is risking an intolerable backslide. According to a tally by Johns Hopkins University, worldwide the virus has infected more than 36 lakh people and killed over 250,000 people.
And now an overview of today's newspapers covering COVID-19 stories. 50,000 cases and counting. Fresh spikes in urban centres is the headline in the Hindustan Times. Minority surge in COVID deaths. Maharashtra plans messages in Urdu, reports the Indian Express. The Tribune notes, single-day count dips. Kerala first state to see no new case. Public transport soon. Government formulating guidelines adhering to social distancing norms. The pioneer quotes Union Transport Minister Nitin Gadkari. Malls, cinemas and retail shops may be allowed at night in green zones. Final decision to be taken after Health Ministry nod, observes the Hindu Economic Times. The paper also writes, auto companies may roll out incentives to draw customers, EMI holidays, 100% on road financing and vehicle loan repayment schemes lined up as showrooms may reopen this week. Repurposed drugs offer hope in anti-COVID fight. ICMR OK's use of HIV/AIDS drug combo, highlights the Times of India. And finally, private hospitals get a lifeline from Ayushman Bharat, reports the Business Standard.
And now, before we end the program, the headlines once again. Government to begin evacuation exercise Vande Bharat mission from today to bring back nearly 15,000 stranded Indian citizens from 12 countries. Home Ministry issues guidelines for movement of stranded Indian nationals returning to the country. Government bans export of alcohol-based hand sanitizers in view of COVID-19 outbreak. Centre asks West Bengal government to lay emphasis on surveillance, detection and testing. Mortality rate stands at 13.2% in the state. And Prime Minister Narendra Modi to deliver keynote address at Buddha Purnima celebrations today. And with that, we end this special news program on COVID-19.